Welcome back to BNC, everyone. With the new strain of COVID announced called Mu and a rise in cases, there are questions about the vaccine and how our bodies fight the virus. Well, joining me now is Nevada physician Dr. Bayo Curry-Winchell. We appreciate you joining us here on this Labor Day, doctor. Thank you so much. No rest, unfortunately, for healthcare workers who are dealing with this terrible health crisis. Data from the Department of Health and Human Services shows more than 99,000 people are in the hospital with COVID, and these cases could get worse as people return from Labor Day travel. Are you concerned about people who have been out and about this Labor Day weekend and maybe haven't protected themselves as well as they could have?
Thank you, Laverne, for having me. Yes, we are concerned from a healthcare community. When we have holidays, as far as congregations and different things where we are gathering together, and if we are not utilizing the sources that we know that really help protect us against the coronavirus, it can be very concerning that we are going to have an increase to the spread that's already happening.
So health officials are keeping an eye on the Mu variant. What should we expect from this variant? What is this one all about?
Well, I think it's always important to remind ourselves about what viruses do, and that is mutate. They naturally mutate. And so, because we haven't reached a level of immunity, it's going to continue to do that. And when we talk about the mu variant, there's still, information that is unknown, but we are concerned. Could this be the same as Delta? It is unknown, but we know that it could have a high level of transmission or higher rate of hospitalizations. And so until we know, we have to link to the measures that help protect us from spreading the virus.
So how could how could this affect the vaccination efforts? Because if we have a new strain and we've had this vaccine now that supposedly works on the older strains, what is that going to do? Is that going to mean we're going to have more booster shots or a new vaccine?
So it's really hard to know as the virus continues to mutate, and until we get that level of immunity with vaccinations, we might have to have another booster. But the important thing to remind ourselves is thank goodness we have vaccine. There are so many other countries who are just wishing they could have what we have in the US. And so we have to continue to push forward and protect ourselves through mask wearing, vaccinations, and just protecting our communities in any way that we can.
So help me understand these antibodies and this whole process that people are saying is something that can help them, the Regeneron. Is that something that is a legitimate way of approaching COVID-19?
So, when we talk about monoclonal antibody treatment, it is a way to help if you were to contract COVID 19. And the goal is not to contract it. So, if you were to actually get the coronavirus and have mild to moderate symptoms within a certain period of time, it can help. But the issue is it's not 100% because it's all about the timing as well as the symptoms. And we can't forget that some people get these long-term complications that can happen. So if we invest in preventing the disease through vaccinations, the hope is we will not have to utilize the monoclonal antibodies.
So can your body actually build up like a natural immunity then to COVID-19?
Your body can. However, we are unsure of how high that level is. And so the thought process some people have is, oh, I already got COVID-19, I'm protected. And that isn't true because we are unsure of the level of antibody protection that you actually have. We are seeing studies where people who contracted COVID-19 maybe months ago no longer have a level of protection versus vaccines. They provide a steady state or a therapeutic level for true protection.
So, Dr. Bayo, it's Labor Day weekend. We know a lot of people have been traveling. They've been out and about celebrating the end of summer. Now we know that a lot of schools will be, the last set of schools will now be returning to in person. Do you expect in a few weeks from now cases to really rise in this country?
It really depends upon all the measures that are in place within certain communities and cities. And so it is possible. I'm hopeful that we do not end up in that situation. And how we do that, again, is just really thinking about not sending your child to school if they're ill, utilizing masks, hand washing, and vaccination. So if you are eligible to get the vaccine, please take the time to inform yourself, educate yourself, just to make sure you are making the best decision for yourself and your family.
All right, well, we certainly hope that these cases don't rise after everybody's been having fun this weekend. But Dr. Bayo, thank you as always for joining us and giving us your expertise on this. And thank you for being a health provider and being on the front lines of this pandemic. Take care.